Good afternoon, everyone. This is Audrey Russo, President and CEO of the Pittsburgh Technology Council. We're kicking off another week of business as usual. And the topics that we continue to bring to you we know are pretty informative, and we're glad that all of you are tuning in to join in all these diverse discussions that we're having and hopefully making meaningful connections. I'm joined, as always, with Jonathan Kirsting. He's Vice President of all things media and marketing at the Tech Council, as well as pay attention. We have a new microsite called Get PGH, and we're telling a whole bunch of stories in addition to doing a lot of our other work. So I want to give a shout out to Huntington Bank, thanking them for the work that they've done in terms of supporting us over the course of this almost a year, which is hard to believe, but they are deep partners with us in all things that we try to experiment and keep the community close together. And I'm sure they are very, very busy again with the PPP round that has just been dispersed, or at least applications have been applied for. They open up today. If you need to have any contact at Huntington Bank, let us know and we'll make the connection. Also, I'd like to give a shout out to the Jewish Healthcare Foundation, who has been passionate about all things that were mattering, particularly over this last year in terms of the pandemic. And today is no exception. We're going to have an opportunity to talk with AJ Harper. He's president of the Healthcare Council of Western Pennsylvania. We're going to talk about a few topics, as much as we can pack in the time that we have together. And of course, 40 by 80, that's the wholly owned subsidiary of the Tech Council, which is our 501c3, focusing on workforce and entrepreneurship. So we've muted your microphones and we've allowed for you to have a chat, to ask some questions and participate. We have lots to pack in these 30 minutes with AJ, but I'm very thrilled that he's taken the time to be with us. So as I mentioned earlier, AJ Harper, and he is at the helm and really involved in many things that many of us aren't really privy to. And I'm pretty thrilled at having an opportunity for us to talk with him. So I'm bringing AJ out, and I'm going to say welcome, AJ. Thrilled to see you again, and thank you for carving out the time with us today, and also for the work that you do. And everyone will get an understanding a little bit about what he does. But before we do that, let's talk about who is AJ. Who is AJ the man, and the man who's actually, the journey of him being at the helm of this organization and how he got there.
Well, thanks, Audrey, and to staff as well for this opportunity. Again, AJ Harper. I'm the president of the Healthcare Council of Western Pennsylvania. We are a 501c3 dues-based trade association, and we cover the 30 counties in Western Pennsylvania. I'm originally from Beaver County, did my undergraduate work at Ohio State, and after about a 30-year career in Cleveland, returned home with my wife as well to lead the council. I've been back for 16 years now.
Okay, see, we didn't even talk about Cleveland. We didn't talk about a game, nothing. So really appreciate that, AJ. I heard there was a game yesterday. So let's talk about the fact of what your organization does. Tell us the mission, tell us a little bit about the work you do, and then we're going to peel it back and sort of cover three topics, and I'm going to mute my dog for a second. So AJ.
Sure, thanks, Audrey. Okay, so healthcare, if we look at healthcare setting at the federal level, the American Hospital Association and the Federation for Hospitals represent hospitals at that level with policy and regulation and review. Every state has a state hospital association. Ours is the Health and Hospital Systems Association of Pennsylvania, led by Andy Carter, based in Harrisburg. And there are about 20 metropolitan or regional associations around the country. So yes, we have a 501c3, but we really focus not so much on lobbying and advocacy. We're more pragmatic. We try to help our members to implement those initiatives that come out of left field, make sure they're compliant with rules and regulations. We do a lot of studies, a lot of training, a lot of education. We consider ourselves a facilitator and collaborator. We're Switzerland, we're neutral. All members come here to address things in common, leave the armor at the door, and work for the betterment of the employees and the communities that they serve.
Well, what about the membership? Talk about the membership, because it's a little varied and you have an opportunity to represent some wider constituencies than just hospital, typical hospital associations.
Right. So when I came here, it was the Hospital Council of Western Pennsylvania. But I was approached right around when the ACA was beginning to gain root and became law by leaders in our faith-based post-acute senior living communities, the Presbyterian Senior Cares, the Jewish Associations on Aging. And they came to me and said, you know, AJ, with the ACA, there's going to be a tighter relationship on reimbursement and quality metrics, and we would like to bring our association into yours. So with that, I did the slight name change to the Healthcare Council of Western Pennsylvania. And since then, also have added specialty hospitals, long-term acute care hospitals, and most recently, Audrey, as I was sharing with you, intellectual and developmental disability providers who have also joined, as well as some classic and very strong outpatient initiative providers such as Adagio Health, Pittsburgh Mercy Behavioral Health Core. So we really are a continuum of care and have providers represent providers across the delivery system.
Wow. So there's so much to pack in this half hour. So I want to make sure that we just pick up a few things. I mean, obviously, we care about the safety. It's important that people who are living in congregate environments get the support that they need. You've certainly been an advocate and an informant to make sure that the support is there and the light is shined. But you focus on a few things. And in my notes, we actually have talked about workforce development. We've talked about food insecurity. We've talked about the actual nurses themselves and supporting them in the environments that they're actually working in. And nursing means, and also a continuum of types of jobs. So where do you want to start with that? Because I think you've made some really good points, and I think the information would be really appreciated.
Sure. I think that when Audrey and I were talking about this, there could be a different time. I'd be glad to come back to talk about the loss of business that was substantial on elective surgeries and procedures, and talk about the strain that's occurring on our nurses, doctors, allied health professions with the surge and with the acute care episode. But there were three areas of concern that we talked about that were there prior to the pandemic, and I think are going to be exacerbated post-pandemic. And so in no particular order, Audrey, I think the first one is the misinformation on public health, or a growing distrust about things that, at least in my generation, we assume to be correct and true. So the science around the vaccines, there's a generation of newer parents who are opposed to vaccinations and immunizations. There's a generation of minorities who are suspect of our federal government's immunization programs, which is warranted from actions and activities, Audrey, that occurred back in the 40s and 50s during and after World War II. There's a growing doubt on science. We hear about the virus being a hoax or the virus being from China. So it's been politicized. There's lack of mask adherence. And so even though they talk about herd immunity, we're not cattle. So I like to call it community immunity. And so those things are there. And again, there will be employees in your respective businesses, folks, as well as the people who I represent, who may not want to get vaccinated for some reason. And so just as we move forward, because I think there'll be something after this, Audrey, there'll be the next breakout, the next flu. We skirted H1N1 and go all the way back to swine flu when I was in college. So we're going to continue to have a degree of outbreaks and viral outbreaks. So my concern about the vaccinations, immunizations, and the science behind it are a concern, and maybe a concern to your members as well for their own staff as employers, or based off maybe technologies or products or services they're developing that they may find something that could help us to advance this cause.
How would you help? How would you help with our members? So there are people who have solutions, and even last week, I actually did a nice connection with you and the Sheets Innovation Center. So people, the opportunity in the market sector is pretty huge in terms of who you represent. But what are some ways that people might get connected and be helpful to you?
Well, we are, as you know, a pretty small shop. There's 4 of us.
Right.
We don't really have a large shared services division, but if you have individuals, and I have talked to people in the past who I've gotten leads from Carnegie Mellon or have been members of the Tech Council, there's a product, service, or application that they think would be beneficial. I would encourage them to reach out to me via email or phone, Audrey, absolutely. You don't have a team to vet it. I can try to find some leads and try to make some, we're all about making connections, and I would be glad to try to make some connections.
Right. So obviously with COVID, it's stretched the capacity of a lot of your members, right? It's really stretched the capacity. What are the things that you've seen, and do you think that we're on an uptick at all? Any changes?
Well, I think that the data comes out, and we do have a staff statistician and epidemiologist, and we know there are major surges around the country. With the first surge last spring, with the surge now, we do have ICU beds available. Our hospitals and nursing homes have responded. We've started to roll out vaccinations to our healthcare workers. It's a Berg thing, right? And we've come together. We've had probably greater compliance than maybe other areas of the country. So yes, we have hospitalizations, and yes, we have deaths. And I'm not downplaying those, but we do still have some capacity in our ICU and our beds. But the other point of that, Audrey, we talked about was the stress on the workforce. And it really struck me before my last board meeting in November, and I got a Modern Healthcare magazine. Obviously the magazine comes out weekly in regard to hospitals and healthcare. And the back page had listed the 1,000 workers who have died from COVID. Doctors, nurses, housekeeping folks, people in facilities. My background has always been in non-patient care, running patient access, health information management, those types of departments. And there was a young lady at a hospital in Miami, a young mother of 3. She was a patient access coordinator, i.e. conducting a registration, and picked up the virus and expired. So we have that stress there, but we also have, Audrey, and folks in both of our disciplines, in tech and healthcare, we share a common vision and mission of recruiting and maintaining a strong workforce here, right, in Western Pennsylvania. And so that existing workforce or population that's eligible, we'd love to see them fill vacant positions. And although there are shortages in nursing and certain allied health professions, Audrey, we have focused on non-acute, where we're really looking to identify individuals who are maybe in big box, retail, fast food, hospitality, to look at coming into a direct care position. Now that could be an aide, that could be a nurse's aide, it could be a medical assistant. It could be someone who wants to go from dishwasher to food prep, to line prep, to cook, to chef. Matriculation programs have been out there in our industry a lot, probably yours as well. But one thing that we're looking at is a friend of mine in upstate New York created a program called the Caring Gene. And there's actually been some research that identifies that there's a genetic makeup of individuals who may be predispositioned to want to get into healthcare. There may be a tech gene as well that directs people to some of your members, right? There's a certain way that directs people to a certain discipline or a certain profession. And we're trying to let people know, hey, there's a solid pay, there's 401k benefits, there are retirement benefits, there's health insurance. A very tough business to get into right now, and not a safe one, where obviously, but that's what's going on with our workforce. And I know we share that in common, Audrey, in trying to recruit the best and retain people who are here as well.
So can you talk a little bit more about the caring gene? Because I would think all of us want to have the caring gene. So Can you talk about that? And then John's going to lift one of the questions that's actually out there.
Yeah, actually, it's a friend of mine from the Iroquois Hospital Association, another Metro association, received a grant, and they actually went out and identified the fact that you have individuals who are in fast food, big box retail, who might have a yearning to do something more. And they created a advertising campaign, and then created a process by which individuals could connect to the long-term care facilities in the region to try to match up with jobs. And then find out and get a job description and interview with somebody. Because, Audrey, a lot of times people will come in and say, hey, I think I want to be a nurse aide, and they can go through the class orientation. But it's another thing when you get onto the unit, and and let's be frank, can you care for someone? Can you change a diaper? Can you lift the large patient? Can you deal with end of life? And so trying to identify, do they have that quote caring gene? But it's a format and a program by which to direct people to those openings, those job openings and opportunities. Wow.
Is there a link for that? Is there anything that you could let us share?
We actually are just in the process of finalizing that agreement and trying to launch that. We'll be launching that here in hopefully end of first quarter, beginning of second quarter 21.
Okay. So we'll stay connected. we'll stay connected to you on that.
Yes.
So let Jonathan ask one of the questions that's out there right now.
Sure.
AJ, thanks for joining us today. Really appreciate the conversation and insights you're bringing us. So we have a question from Sam Brower, who wants to know, says, there's a challenge of getting COVID antivirals into clinical trials now because a lot of hospitals have been booked by major pharma. Would your organization help a small out-of-state company do a clinical trial on a novel antiviral?
That's out of our scope. Thank you. We don't really have a clinical presence, so that would be out of my bailiwick, out of my scope. Probably out of the State Hospital Association as well. Let me think about where I could direct that individual, but I don't have anything off the top of my head.
Fantastic.
Okay.
We'll circle
All right.
back.
There's a way. That's great. So thank you.
Yeah, thank you. Sorry.
So let's continue to talk, right? Let's continue to talk. We talk about workforce, right? We talk about the demand, we talk about the gaps, and we talk about the opportunities. And what about you were awarded a grant, I believe, from RK Mellon?
Yes. Thanks, Audrey. We did receive a grant from the RK Mellon Foundation for a program that we have called the acronym of CRESP, C-R-E-S-P. And what we're doing there is our 10 faith-based post-acute providers, again, the JAA, Presbyterian Senior Care, Lutheran Senior Life, Ascension Collaborative, Baptist Homes, et cetera, came to us and said, our workforce is really stressed, and we have the most economically fragile workforce caring for the most clinically fragile population, our members that are in in our care, in our nursing homes, skilled nursing, personal care, assisted living. And so in an effort to help those individuals who may have lost maybe their significant other, their partner, their roommate has lost their job, and so there's a drop in income, that we actually teamed up with the Greater Pittsburgh Food Bank, with Reinhardt Foods, and with Marburger Dairy to deliver food packages to employees of our member organizations. So food insecurity is just not within the population that's being cared for, but it is with the caregiver. And so we've been very pleased to work with, receive the grant from the RK Mellon Foundation, work with primarily those three entities to provide food boxes of produce, dairy, and dry goods to our employees of our member organizations in long-term care.
That's actually quite disheartening, right? I mean, I'm glad that you're doing this work. And so here we are trying to attract people into this field, and yet we're dealing with food insecurity. Right.
Yes. I think that when, and that gets into, Audrey, we talk about going from the 501c3 to the C6 and talking about advocacy. And that's when you're talking about reimbursement rates for Medicaid for skilled care. I think Pennsylvania being 48th out of 50th. So a lower reimbursement, obviously lower wage rates, but again, other benefits, and in this case, trying to assist those who are extremely stressed in long-term care with a food insecurity program, as well as doing some other things as well. With Citizens Bank doing a financial literacy program, and then working with Pittsburgh Mercy Behavioral Health on an assessment, kind of an emotional behavioral assessment of the employees, so they can really talk about what the stressors have been, and then trying to identify initiatives in addition to their own EAP programs, Audrey, where we can provide assistance to those employees.
Yeah, I mean, and are there, why are we 48th?
It's probably historic, work out of Harrisburg in regard to methodologies, and that's an entirely, that's like a 2-hour session right on the methodologies in which you determine how you get paid.
Right.
And again, those MA dollars, folks, really are spread across acute care, long-term care, intellectual and developmental disability, behavioral health, and drug and alcohol. So the issue of reimbursement and a proper level of reimbursement is something that we will always advocate for, or Audrey, the state associations would be advocating for that. So tied to that, though, Audrey, is this whole issue of health equity, right? And we talked about that a little bit. And we've had a Pittsburgh study that's talked about lack of access to care for minority populations. We've seen a statewide study that demonstrated an unacceptable rate of maternal mortality among African-American females. And health equity, to be honest with you, has gotten the attention of healthcare more recently. Whether that's workplace violence or violence in the community, what's the role of the hospital or the provider in supporting the community? And we also know health equity is not only lack of access to care, which could be driven to indigent or minority populations, but there's housing, there's transportation. The two things, as I mentioned to you, Audrey, because we're a small shop, is that we've focused on health literacy. And we're focused on food insecurity. And so those are the two, health equity is a large lift. I have a center for health equity, but honestly, that's one person, Hillary Holes, young lady who works for me. And so we're trying to pick and choose, like the lead in talking with Sheets the other day, to try to find where we can help our members help their communities.
So there's two questions out there Jonathan's going to grab.
Okay.
Absolutely. First off, are we okay with PPE, or is there a shortage at the time?
Good question. There obviously, the initial surge was a shortage of PPE, both out of FEMA, the federal warehouse, and then the state stockpile as well. But that has been addressed. I could tell you that, Jonathan, my members are saying to me that they have not identified a shortage. Maybe some of our smaller personal care homes that are out there, people who aren't members of council, might be finding a shortage. We've actually did a contract with Amazon where we're now the member, and we can direct nursing homes, personal care homes, assisted living facilities to Amazon business if they cannot find PPE through their normal vendor. But short answer is no, we've been resupplied with PPE being, to me, gowns, masks, gloves, and other protective equipment.
That's fantastic to hear. It makes us all feel better knowing that's being covered right now. So a question from Eileen Wickett wants to know, for the faith-based long-term care, is anyone focused on staffing levels or Medicaid reimbursement?
Yes. Now, the Medicaid reimbursement is dealt with by their state association, Harrisburg Leading Age. And we are working with our own members, our COOs, our HR executives, and our CEOs on what I just mentioned, this Caring Gene initiative that we're trying to address and try to not only recruit, there's recruitment and there's retention. And so we're trying to roll out more. And I would think in the course of this year, I'd have a little more on the tail end of the quarter to talk about what success or failures we've had in trying to help our members to address that.
Absolutely. And Ingrid Cook just chimed in with a question. Good to see Ingrid here on the call. She wants to know, can you talk more about your health literacy efforts? Is there a reason why you're starting with restaurant workers to detect the caring gene? Will there, and wants to know, will there be other industry sectors included in the research? Do you offer smaller caregiver agency assistance with locating workers?
Yeah, so obviously we're a member-driven organization. So the Caring Gene model was one that was done with long-term care organizations of scale up in upstate New York. That's why I'm trying to replicate it here. Additional rollout, possibly would like to see that. The first part of that question again, Jonathan, was?
Wants to know, let me see here. Is there a reason why you're starting with restaurant workers to detect the Caring Gene?
Oh yeah, it was just to look for individuals who are in fields that have been upended really with income and yeah, exactly right. So so that's why the Caring Gene, again, it's a trademark. It's several strategies underneath that.
Right. Very cool.
So is the closing of long-term care facilities, some of them that have occurred, is this related back to your point about us being number 48 in the state and the reimbursement?
Yes, the suppressed reimbursements. So, if you go back, and I've been around for a while, so at one time there was an intermediate level of care for which you were reimbursed, and in the skilled care. Now our members will get reimbursed for skilled care, and and again, because of the push of patients, accelerating from the hospital out, our skilled units are both in our hospitals and in our freestanding facilities have a higher acuity, a higher level of illness. But if you don't qualify for skilled, Audrey, then you are in either personal care or assisted living or independent living. So there's those stages, and the only one that's really reimbursed by the state under the Medicaid program is for skilled. So personal care, assisted living, and independent living is not. So that's an out-of-pocket expense where many of your not-for-profit faith-based will subsidize that with their benevolent care funds.
Okay, and then there's another question from Sandy, Jonathan.
Yeah, it says, first of all, it says from Sandy Sinks, it says, it's great to see you. Have there been any discussions with your members regarding the COVID impact on long-term real estate needs?
No, there has not, because and that's a good question, Sandy. I think I would look at that because we are our members both in IDD, the IDD world, the intellectual and developmental disability world. I think that, Jonathan, that was somewhere in one of the questions, really moving that entire population from institutional care to residential care. And so there would be a growth in probably the need because that population is also aging. And then I think the money that is being spent is really on trying to get high-tech, personal care, independent living sites, and most of my members are doing that. So I think there'll be some growth there. I just don't know what it would look like, but it won't be the classic skilled bed. It will be more of a personal care with, again, high-tech, high-touch rooms that would allow patients to, obviously monitor their care and try to intervene sooner than later. So, and in case there's an acute care episode. So, see, Audrey, I know we're at 12:26. I just wanted to just say, we talked about the process working. And in this case, I just wanted to share something with the members. So the CARES Act funding was what obviously was produced by the federal government, and each state received CARES Act funding. And so right before their departure, Mike Turzai and Harry Reedshaw on a bipartisan initiative created the Seniors Care Act, which brought $175 million into the state, Department of Health, Department of Human Services. And the state in turn reached out to the 7 major academic teaching centers around the Commonwealth and said, help us to implement this initiative. And so we were very proud to be part of an initiative with UPMC, AHN, Healthcare Council, and the Jewish Healthcare Foundation, where we went out and we conducted rapid testing when there were outbreaks. We did assessments, clinical assessments, infection control assessments, delivery of PPE, which was an earlier question, and then of course Nancy Zions with her training and education program. So there's an example there, Audrey, of going from the 501c6, the legislation,
right,
and getting the reg and then applying it and putting it to use and putting it to the end user. And that's been a very solid and positive program that's resulted out of this pandemic.
So AJ, what do you think? We're gonna, with the new president coming in and Washington changing some of their hands, and you wearing your advocacy hat, what are you hoping for? What might be some priorities as you wear that hat? And what can we do to be supportive of your efforts?
Well, I think we need to start and see, I was just again reading a magazine where several of the nominees by President-elect Biden will be going forward, Surgeon General, Health and Human Services, CMS, et cetera. I think the biggest thing, Audrey, that the American Hospital Association, the State Association, and we were supportive of was the Affordable Care Act. And why? Because it was expanding coverage, right? Medicaid expansion to get those who don't have coverage some degree of coverage. And the current administration has continued to peel back on the ACA. So I think that President-elect Biden said, hey, there are some things that worked well, some that didn't. And I know on the business side, there are issues on the tax base and so forth. But as it relates to where we stand in regard to coverage and access to care, obviously that's first and foremost on my list, that there would be some additions or bringbacks as opposed to the takeaways on the ACA. As far as you and your members, I think simply, we're here as an association, you as well, and we just need to continue to collaborate and make sure that we know what each other's doing. And however I can help your members to try to get in front of my members or promote something in the healthcare field, I'd be more than happy to do that for you.
Is there anything that we can do in terms of your focus that you have on food insecurity?
On food insecurity, I think that as employers, if there are programs, we talked about, your own foundation, we talked from the folks from Sheets the other day. If there are initiatives, I think that Audrey, I'm back to Maslow's hierarchy, right? Food and safety. Personally, that's where I'm at. And so I think that any initiatives around food insecurity, the Greater Pittsburgh Food Bank with the person who I think is Pittsburgher of the Year, which is Lisa Scales, my humble opinion.
We had her on right at the beginning, and we've raised money specifically, but I'm thinking about your food insecurity focus, particularly on those people who are working in a lot of these high-risk jobs and their compensation might not be high enough.
High enough, right, yeah. And that's something we can continue to talk about offline, strategize on, absolutely, so.
Right, so if people want to reach out to you, can they reach out to you?
Sure. Absolutely.
Put your email out there or for LinkedIn?
Right, on LinkedIn, I think some people have already. Again, it's aj.harper at hcwp.org. We're here in Warrendale, and I'm around, so absolutely.
Is
Appreciate it.
around.
Yes.
So I am so glad that we had a chance to pull you into our world and us to get pulled into your world, because it takes all of us to do this kind of work. These are trying times, to say the least, and we are looking forward to making some headway in terms of the future. Thanks for your leadership on workforce development, food insecurity, and for all the array of things that you try to deal with your lean staff in these trying times. So thanks for taking the time with us. Really makes a difference. We are educated as well, and that helps your mission. So thank you, AJ. Stay safe and stay active. Keep your voice loud and large, because that's what we need. So thank you for taking the time with us today. Really appreciate it. Jonathan, what's on board? What's coming up?
We have what I considered the fifth Beatle of business as usual stopping by tomorrow. One, Kelly Hunt from the Small Business Administration, talking about the new PPP stuff.
Okay.
Yeah,
so that's because of the new PPP, the release of the new PPP. In case we need some additional support, Kelly is going to be here to talk about that. That's excellent. Okay, so thank you, AJ Harper. Thanks everyone for joining us. Stay safe, and we will see you here tomorrow at the same time.
Right.
See you, everybody.
Thank you. Appreciate it.